Now that you've completed your spring course requirements, I wanted to share this short video with you to remind you of what we talked about during our initial meeting for this integration group, remind you of some details in your preliminary contact with your preceptor, preparing for your first clinical day, and what to focus on. Remember, you will only have 10 days, so make the most of each day in this practicum. The most important aspect of preparing for that first clinical day is to get a good night's sleep or a good day's sleep. I will talk more with you individually, especially those of you on nights, about strategies for getting quality sleep in view of your schedule. But do get a good rest before that first day. Another activity to prepare is to review or at least find and have access to handouts from your previous courses, tips on normal labs, medications, diagnoses, treatments. Get that ready now so you can have it in a packet that you can carry with you. Review basic skills, catheterizations, catheter care, skin assessments, venipunctures, IV starts. Those of you at Dell, review developmental milestones. That is where you will actually use what you once thought was only for an exam. And in addition to the cognitive preparation, remember to get your uniform and shoes clean, patched, stains removed, whatever else needs to be done. Remember to have your nails trimmed and your hair away from your face and pulled back at all times. When you first begin to work with your preceptor, clarify the work schedule. Clarify what time to report consistently, what to bring, personal equipment. Ask also about meal break times. Do you generally have time to go to the cafeteria? Is the cafeteria even open during your shift, or should you plan to bring a lunch? It helps to know these things. Review and confirm with your preceptor or another person where to park, and make certain that you park where you are told to. Confirm how to access the unit with a code or a badge, barcode, or other ID. You must have your UT name badge at all times, but you will probably also have an agency badge that may have a barcode to access certain areas. Ask your preceptor policies about personal electronic devices. What are the policies about personal phones, sending and receiving personal messages while on duty? A text or phone message to me is not seen as a personal call, but please remind family and friends that you are now working as a nurse, and personal calls and text must be limited to extreme circumstances only. Also, ask your preceptor about the most frequently seen types of patients or diagnoses or conditions or medications. This will give you an overview of the unit and give you a heads up on what you need to review for in your first few days on that unit, so you will be better prepared. When you have your schedule, or at least the first few weeks or the first few shifts, notify me via email of that schedule. Remember that you were assigned by someone who does not know you or the preceptor. And even though I checked this out beforehand, there's always some situations that we need to deal with. So be prepared for your first clinical day. Be on time, ready to go at the assigned time. Day 1 will primarily be a shadowing day. You may have full compass, you may have full documentation or other privileges, or you may not. So do not plan to give meds on that first day. You may give PO meds if your preceptor approves and is willing to complete that documentation, since you probably won't have full access, but don't be so concerned about that. Do check during your first day to make sure your badge works to access areas, the nutrition room, linens, treatment rooms, med rooms, unit access. If it does not, You'll need to notify security at the hospital to reprogram the badge. Call me, area code 512-971-4823 if there are questions. Also, try to do a scavenger hunt of sorts. Use those from previous courses, but find out where the supplies are, the treatment room, equipment room, meds, linen, nutrition. Know where routinely used supplies are kept so you can access everything quickly. I do have Compass access for those of you at Dell, and when I meet with you on your first day, I will give you those codes. Those of you out of town, I will talk individually with you about computer documentation access. Many times agencies will restrict student use significantly in terms of online documentation. Do not be concerned about this. Spend time reviewing the equipment in the treatment room so you can find things quickly if needed during a procedure. Make certain you locate the crash cart. Check with the preceptor regarding emergency evacuation procedures and where equipment is kept. Review your rooms to see what emergency equipment is kept at the bedside. During your first clinical day, I will visit or at least make a telephone contact to review the responsibilities form and get that form signed, and will pick up the preceptor information forms. During our first visit, I will review the potent medication list with the preceptor and what medications you cannot give. Blood and blood products, chemotherapy, AccuChecks, those kinds of procedures that students are not allowed to give. I will also talk with those of you at Dell about central lines and PICC lines. Dell is a little different from other hospitals in what students are allowed to do with central lines. I will review the documentation requirements and what is feasible in your situation regarding access to electronic charting. We'll also have an understanding about what can be done in the event of a preceptor illness or a change of schedule. Again, each unit is a little different in what the options are. Please do not worry. We will ensure that you are able to complete your 120 hours required for practicum. Do have my phone number programmed into your phone. Area code 512-971-4823. Call or text for any questions you have, and certainly call or text if the schedule changes. Please remember that you do not have to be concerned with the faculty on-call list as discussed in class. Call or text me regardless of the time. Remember that for your first few clinical days, be prepared to call my office, my faculty office, area code 512-232-8264, to give a change of shift report. Use the guidelines that I gave out during the orientation. I've also included a copy of the change of shift guidelines as an attachment to the email that I have sent with this YouTube. You may call in the report from the unit before you leave, but do not tie up a unit phone to make your change of shift report when other nurses are needing to give voice care or other verbal reports. Or you may call in from home or wherever, but I prefer that you do make this call within the first 2 hours after the end of the shift, otherwise you will forget some details. Practice it so that the report is no more than 10 to 12 minutes. I will give formative evaluation back to you in an email. Again, this is not graded, this is practice. Within the first few clinical days, talk with your preceptor or unit educator or charge nurse about how to meet the leadership objectives. Begin to see how that can be scheduled. We will address that one item during the mid-semester evaluation, which is usually done on your 5th shift. And when I visit, we can talk to see how best to complete these objectives. Every clinical day, I would encourage you to keep your time log, have the preceptor initial it every day. I would also recommend that you keep a clipboard or a notebook or something with you where you can have access to the syllabus and your time log and space for any resource materials. But remember to keep the clipboard and information covered. Remember HIPAA regulations. You may not copy any patient records for any reason at any time. Do not use your cell phone or iPad for any improper photography or other types of media communication. Every day, have specific objectives for what you want to accomplish and share these objectives with your preceptor. When I visit, I will ask informally about your objectives and how well you're able to meet them. This is your experience, so plan for it that it will result in what you need and would like to accomplish. I would also encourage you to plan to do clinical reflection of your activities and decision making each day. Think back how you identified and solved clinical problems, or how you made accurate assessments, or how you made some incomplete assessments. Plan to do better the next time. Evaluate your practice on a systematic basis each day. And the evaluation criteria in the syllabus is a good guide to begin with. We will do a mid-semester evaluation during your 5th scheduled shift to help you and the preceptor plan for specific activities during the remaining shifts to ensure you complete all objectives. So to summarize, when your preceptor calls ill or you are already on the unit or planning to attend, call me. We will see about an alternate preceptor. In addition, if your preceptor knows beforehand that she will be canceled for a scheduled day, call me and we'll see about an alternate preceptor. The first few times we meet, I can have a better idea of how we can have a backup plan because each unit and each staffing situation is different. Remember, you cannot move with a preceptor to a vertical or an increasingly acute level, but you can move with your preceptor on a lateral transfer from one unit with a specific patient acuity to another comparable unit with that same patient acuity level. And we will discuss this also during our first meeting. Remember that you are in essence interviewing for a nursing position every moment you are on the unit, or in the cafeteria, or even walking across the parking lot. Most professional positions are obtained through networking, and nurse managers and employers are always looking for quality patient care, for individual concern, and for personal integrity. In addition, remember that you represent nursing and the University of Texas at Austin School of Nursing. Make certain that at all times you represent yourself, nursing, and the School of Nursing proudly. Plan to have a great time. This is a marvelous opportunity. We will be available to help you maximize every possibility and ensure that it is a great experience for you. Call or text 512-971-4823 if you have any questions. Have a great time.